Good day, my name is Vasanthi. I'm a Bachelor ODL student. Today I'm going to do a presentation about Mri Artifact. Due to the medical condition, I have to wear this spec. I'm so sorry. Let's go to the slide. Introduction to the Mri Artifact objective. What is Mri Artifact? Mri Artifact are distortion or error in the images that do not represent true anatomy or physiology. So how it generated? By behavior of sample, imperfection in the equipment or its operation, and poor optimization of measurement sequence. They can lead to misdiagnosed or reduced diagnosed confidence. So understanding artifact is crucial for accuracy interpretation of MRI. So we must know the artifact to identify correct or accurate pathology in our MRI images. Important of recognizing the MRI artifact, as I told you just now. First, a prevention misinterpretation of the image. Artifact can appear as lesion or other abnormalities leading to the incorrect diagnostic or not identified as artifacts. Second, to help differentiate between real pathology and imaging error. Accurate diagnosis based on the properly interpret MRI scan, which contribute better patient outcome and accurate pathology. And finally, guides corrective action to improve the image quality. So like as you can see, recognize artifact help in optimizing scan parameter and protocol to minimize the impact on image quality. Classification of MRI and the main categories. So I can see patient-related artifact, example motion, breathing. Hardware-related artifact, example magnetic field inhomogeneity. Technical artifact, which usually happens, alliance and transfunction. And signal-related artifact, chemical shift and flow. Three main MRI artifacts that today we choose for the presentation. First, motion blur. So let's see the image. So you can see the image bottom, the motion is corrupted and the motion is corrected afterwards. Second, the signal loss, and the image just coil turn off. Due to the signal loss, we lost the image detail. So the coil turn on and then the detail is normal. Then is image distortion. So the image is distorted. As you can see, motion blur caused by patient movement during the scan or physiological motion, example cardiac or respiratory motion. Motion artifact caused by breathing, cardiac movement, CF pulse, blood flow, and patient, which create ghost artifact. Appearance second. It appears blur or smudged region in the images. Loss of anatomy details often seen in dynamic sequence like fMRI or cardiac MRI. Correction technique. How do we correct the motion blur? Used a motion corrective algorithm. Shorter acquisition time. We make it the procedure as faster. And a breathing hold technique or respiratory gating of instruction. A sedative for uncooperative patient due to the movement of this. This sedative is usually given if the patient have tremors, claustrophobic, which we need to do the MRI due to the diagnostic purpose, and we work with the sedative to avoid the motion blur. The motion blur is the common blur Okay, as you can see, this is a case study. A patient with tremors show blur image in brain due to the involuntary movement. So what we can do is we can see using a shorter TR or TE and respiratory gating improve the image quality or clarity. Let's see, the second one is signal loss. The signal loss is caused incomplete signal reception due to the metallic implant of foreign bodies, can be field inhomogeneity, insufficient RF coil coverage, and signal dropout can also occur due to the susceptibility effect. Sorry. Second, how the appearance would look like. Dark area, a void in the image where signal should be presented. It can mimic like a pathology, infract or tumor. So the correction technique is use a different pulse sequence or optimizing or RF coil, avoiding metal object in the field or susceptibility artifact. By using parallel reduction technique, by using a parallel image. Okay, this is the case study that I can show to you. Like a patient with a pacemaker shows area around the device signal loss. Using a gradient echo sequence, minimize the artifact. Third, image distortion. Cause susceptibility difference between tissue. Example, air, tissue inference, bone tissue, and interface. Presence of ferromagnetic metal. Example, dental field is inhomogeneity. So appearance, wrap up or stretching in the image, especially near to the interface. Misalignment of the anatomy structure. So the corrective technique is with susceptibility weight images SWI to highlight the distortion. Gradient shimming to correct the field homogeneity. Avoid metal object on using non-metal alternative. So case study shows that patient with the dental braces show distortion image around the oral cavity. Solution: remove metal object or using a special coil improved image quality. So as you can see, that is a summarize of the additional notes for the summarize of the presentation. Motion blur is patient movement. You using, how do you correct it? You use shorter shorter acquisition time, motion correcting algorithm, and then the signal loss caused by incomplete signal reception. So different pulse sequence and optimizing R coil placement. Image distortion, susceptibility different of metal object. Correcting gradient shimmering, avoiding metal object. So as you can, this strategy to minimize it, like pre-scan preparation is very important. Ensure patient immobility. Remove metal object. Provide clear instruction for every breathing and patient procedure. Scan optimization. Regulate maintenance to the MRI machine. Calibrate the gradient and RF coil. Use a proper pulse sequence and post advanced software tools to artifact correction and review image with the radiologist experience. Challenges in managing artifact. Complexity of in MRI parameter, many variability, TR, TE, flip angle, and example, effect artifact formation. Patient factor, uncooperative patient or those with movement disorder. And finally, we can see that cost and accessibility. Advanced technology like may be expensive but unavailable in some settings. Finally, this is the reference. And conclusion, MR artifacts are common but manageable. Understanding the cause and appearance is initial. Collaboration between radiographer and radiologist improve the outcome. Thank you.